For eyewitnesses of this tragic day, it looked like the end of the road for Samuel Omaku, a 36-year-old resident of Abuja. He, his wife, and her sister were involved in a devastating accident that took his leg and claimed the life of the woman he loved. For many amputees in Nigeria, an accident is only the beginning of a harsh, painful new reality. One where limbs are lost. Yes, but so too is mobility, dignity, and pride. Like Samuel, many retreat into the shadows, isolated, unseen, and unheard.
I tried to manage it alone because sometimes I just feel if people do something to me and I just feel it's because of my condition. If not because of my condition, this person will not do anything. But to avoid that aspect of thinking, if it's not because of my condition, and it will be affecting my healing. So that is why I try to be reserved and stay away from people.
But Samuel is not alone. In Nigeria, about 11 to 29 million people are living with one form of disability or another. Less than 10% can afford a prosthetic. The rest left to crawl through life, forgotten but not broken. A prosthetic limb can cost from 1 million naira for a locally made below-knee prosthetics to 30 million naira. For most Nigerians, that's an impossible price. So their limbs are amputated, and with them, dreams, careers, and hope are cut short. Just when the darkness felt permanent, hope returned. Through Chen Education and Development Empowerment (CEDE) and Federal Inland Revenue Service (FIRS) reached out, not with sympathy but with solutions. For many amputees, it was the first step towards standing tall again. Beyond collecting revenue, FIRS chose to give something greater: hope. Through its CSR, it partnered with CEDE's Transforming Lives Prosthetics for Progress initiative. Together, they are restoring dignity, one prosthetic, one step at a time.
We reached out to Federal Inland Revenue Services with a detailed proposal of our initiative and also detailing how such projects could have a tremendous impact on the recipients. So they saw our vision, they understood it, and they chose to support by giving this set of Nigerians their legs back.
FRS have been instrumental. If they did not provide the backbone for this, we still would have been doing it at a very little level. And they provided a grant for which this is being done. And also they've actually been rigidly monitoring the recipients and then the whole process of these fitting of prostheses. So without FRS, I mean, this wouldn't have been a success. We would still have been doing 1 or 2, 3, 4 here and there with the impact very little. But now, there's a significant impact on a wide range of population. So yes, they've been instrumental to all this. The Chen Education and Development Empowerment provided a platform for which the FRS now came on to expand the scope.
Chen Education and Development Empowerment (CEDE) sparked the vision. FIRS gave it wings. Nisa Garki Hospital brought the medical support. Together, they're delivering free lower limbs and upper limbs prosthetics to financially disadvantaged persons living with disability in Nigeria.
Okay, working with Chen Educational and Development Empowerment, along with the Federal Inland Revenue Services on this project of Prosthetics for Progress, has demonstrated a synergy between two bodies who are keen at seeing those who have lived without hope become hopeful.
The making of every prosthetic limb begins with a story of pain, resilience, and hope. Each journey starts with a medical consultation. Then, limbs are tailor-made to suit the patient's lifestyle and needs. From socket molding to the final fitting, precision and personalized care are non-negotiable.
After general screening, to know even they qualify, and also checking their stumps to know if their stumps were healthy enough to receive prosthetics. So after that, their stumps were molded, and that was phase 1. Then phase 2, we had the same number of people, inviting them back to Abuja again for the training exercise. First, we had to fit the same prosthetic. Remember, it was molded, so we had to fit to make sure that it fit the stump. And when it was achieved, we had over a several number of days. They went through training, how to walk, their balance, and then also a bit of their mental health lecturing, and also how to take care of the prosthetics eventually.
With the CEDE Transforming Lives Prosthetics for Progress initiative, FIRS is doing more than replacing limbs. They're restoring hope, reviving ambitions, and building pathways to a brighter tomorrow.
When anybody has an amputation, either a hand as upper limb or leg lower limb, first and foremost is that before you have the amputation, we get to counsel you. We even sometimes bring people who have some amputees around, physically, so to tell them, look, it's not the end of life. Then immediately after the amputation, yes, we need to counsel you. The reason is that it's actually a depressing situation. So we get some psychologists and behavioral physicians who actually talk to the persons to tell you that, look, there's life after amputation. That's not the end of life. After that, we'll counsel you on need to get an artificial limb. That is where the problem now lies. A good number of the masses will not be able to afford that, but we still encourage you, in as much as you can, get a walking aid. Then the next thing is that follow upon that, they actually still feel some form of sensation in the leg that was gone. The sensation that the leg is still there. So these are things we counsel, and it's a lifelong thing for those who can afford. But the challenge is these people are actually coming back to the hospitals to get this kind of care.
Each prosthetic limb tells a story. Behind every fitting is a journey through pain, perseverance, and hope. Meet some of the recipients of CEDE's Transforming Lives Prosthetics for Progress. Ordinary Nigerians with remarkable resilience. A staff member at a logistics firm, Samuel Omaku, full of life and plans. But a tragic accident changed everything, taking his leg and the love of his life, his wife and unborn twins.
In life, I was not thinking I could walk properly like every other human being again. So I was just what I've always depended on was the crutches alone. So, but when I heard of the news, really from the beginning, I didn't really take it serious, but visit of the organization where I went for interview, my cast was taken, I had all hope, and I believe that God has sent, is just like God has sent me an opportunity to walk like every other human being again.
But today, Samuel walks again, carrying both sorrow and strength with every step. Professor Oluwole, a professor of pathology at the University of Abuja, lost his leg to complications from diabetes. Yet he remains committed to lecturing, mentoring, and research.
2023, I came down with swelling on my leg, and that necessitated me to go to the hospital, and led to the fact that I was told that my leg had to be amputated. I have to do a below knee amputation, and it was quite rude and shocking. But I was between life and death. Should I allow the leg to remain, and then I just go on because my kids are still in school? So I had to take the decision by myself that the amputation should be done, so as to salvage my life, because as at that time, almost all part of my body was swollen because there was a serious infection. So the amputation was done on the 14th of February 2023.
With his new limb, he stands tall once again, physically and academically.
It's good to have two legs to move about, because during my hospitalization, I wasn't really happy with myself, but I'm full of gratitude that I once had a leg, and then I also want people who have two legs to appreciate God. And then I also want to say that we need a good support system to come out of our pain, to come out of our challenges. And then we also need assistance of the government, and we thank God for FIRS and CEDE for what they are doing. They have shown human face that it is possible for one to get on one feet again.
Miss Perpetual, a community school teacher, lost her leg to an unknown infection. Yet for years, she stood in pain but unwavering to teach her pupils. Giving up was never part of the lesson.
Even while in school, I was using crutches, and it was not easy. While I was doing my NCE, it was not easy because sometimes it would give me scars here. It was painful. It was stressing me, but I felt bad. But now I have put myself together.
Now, with her new limb, she walks into the classroom with confidence and comfort.
It is an empowering experience, like me coming together, meeting people, sharing their experience with me, and having a prosthesis that I was thinking that how can I raise money to get this prosthesis. So it has empowered me in the way that at least now I'm free, that now I have a prosthesis. Even if I am walking now, I don't have the tension that how can I raise this money to make this prosthesis. It can help me to do my work well and also to face my vision as a person. FIRS and CEDE, I am grateful to you all. I don't have anything to give you, but I pray that God that rewards will reward you greatly.
Umar Haruna, a brave member of his community's local security force, CJTF, was on a rescue mission when a bullet took his leg.
When they took us to the hospital, we were about two in numbers, and they said my own is to just cut off the leg. I heard it from the window before the doctor now came in and said, I said, there's no problem. Some people died, and I'm alive. Cutting it, that's the first question I was cutting it, would it affect my life? They said no. I said, oh, there's no problem. You should go ahead. They brought the form and a sign. My uncle refused to sign because he was, that fear is in him. And I said no.
Through CEDE's Transforming Lives Prosthetics for Progress initiative, Umar regains his footing and his mission. A new leg, a renewed purpose.
As if I'm not going to work again, like serious. Who is that person that will assist me? It's in the back of my mind every time I do think of that. But I believe assistance comes from the Lord. I'm very happy for this prosthesis. At least they gave me a second chance to become like before again.
Adiku is a passionate farmer and an Okada rider by trade. A crash on the road took his leg and nearly his livelihood, but not his will to work the land again.
I feel very, very bad because I don't believe that my leg will be like this. So I thought that I even told the doctor he should give me drugs, then let me die, because I can't be in this kind of condition. I can't be in kind of.
Today, Adiku still carries passengers with his motorbike and farms for others, even on one leg. Not for himself, but to financially provide for his family. He never gave up.
I thank God for my life. As I'm sitting down today, I'm so much happy in this world. I don't believe that I have a second leg. One, I did not have the money. I thank FIRS, CEDE. I thank them. What they have done it for me. So I thank them so much. So God provided for them.
Lucy was just a teenager when a football injury took her hand, but not her dreams.
There are some people that I will wear a dress. Your dress is fine. Who made it? And when I say I made it, they will, you did? Wow. You don't mean it. There are some people that they will even recommend me to, and when they see me, they say, oh, we are sorry. We can't give you the job. Yeah, I've encountered people like that. Because of my disability, they don't give me the job. Even as humans, we face discrimination. Not to talk of someone with a disability. The discrimination was there. When you walk on the road, you see people staring at you. You see people telling you sorry.
Today, as a tailor, Lucy stitches more than fabric. She saws hope. She proves ability is not in the limbs. It is in the heart, the hands that remain, and the will to create.
I'm very grateful for this prosthetic. I feel very excited. I don't even know how to express myself. I'm grateful that I'm being opportune to access this, to have this, or be one of the beneficiaries of the prosthetic. I say thank you to CEDE. I say thank you to FIRS for picking me to be a beneficiary. And I don't just want to be the only one sharing testimonies. I look forward to other people sharing this opportunity that I have gotten to.
Through FIRS and CEDE's Transforming Lives Prosthetics for Progress initiative, every prosthetic limb fitted does more than restore movement. It's a second chance, a return to self, and a step back into dignity, one step at a time.
Thank you.
At the heart of Transforming Lives, Prosthetics for Progress is a simple truth. Mobility is possibility. Almost 123 lives have been transformed since the beginning of this initiative. Picture Nasil from Kano, a secondary school student whose leg was crushed by a truck in his neighborhood while playing. Picture Abdulmumuni and Uzoma Ofo, both bilateral amputations, who practically walked into our center crawling on their two amputated limbs. Picture Barnabas, a student of Kaduna State University, a final year student who came in here while he was writing his final exams. Hope restored back to him. Picture Professor Oluwole, a professor of pathology from the Department of Pathology, University of Abuja. Picture Abba Adiku, a commercial motorcyclist from Benue who lost his limb in the course of an accident while engaging in his work and daily hustle. About 123 lives has been transformed through CEDE's Prosthetics for Progress initiative. Each story a testament to mobility, dignity, and hope. These artificial limbs are not just tools or silicons and metals. They are bridges back to possibilities. Lives restored, future rewritten. This moment calls for champions. Just like Federal Inland Revenue Service, your partnership can help amplify the reach and magnify the impact.